Greetings everyone, this is Bhealthy. We are the Africa Health Tech Summit, which is happening as its third edition. It's happening here at the Kigali Convention Center, and some of the sponsors or the partners of this conference, of this summit, is the Africa CDC. And here we are one of its representatives who have accepted to give us a very short interview that we are going to be conducting here at its workshop. So you're most welcome, sir.
Thank you for having me.
At Bhealthy. Could you please introduce to the people watching us?
Hi everyone, my name is Cyril Seck and I'm in charge of digital strategy at Africa CDC. So I work with a team of great people. We're based in Addis, and what we do is serve the African Union member states with developing their digital health systems. So what is digital health? It's not a new layer that you would put on top of existing service deliveries. It's really about transforming the way you operate as a country, transforming your health systems so that you can leverage the benefits of digital. And you may know that in Africa we're suffering from many issues. The first of which is the lack of health workforce personnel. And what we do with digital is that we strengthen the existing teams. We help them to communicate better with telemedicine, tele-expertise, but we also help the people making investment decisions to make sure that they allocate the resources they have in the right places. So digital is really about reinventing how you deliver healthcare and public health.
Wow.
So that you have more accessible services, more quality services, and you drive costs down.
Wow. So I think you are now operating the whole of the AU countries and
55 of them.
55 countries. And currently we are facing challenges and outbreaks. How is this digital solutions helping to deal with these outbreaks? And
there are many ways where you can leverage digital health approaches and tools. It's not only about apps, it's also about new processes, new ways to consolidate information and through big data and AI algorithm make sense, identify trends where it would be quite difficult for one individual to see the outlier and where we're heading. Mm-hmm. So we're still a very young organization. We've been funded by the African Union member states 7 years ago.
You mean this Africa CDC?
Yes,
okay.
We're still a very young child, of the member states. But the core of our mandate is really to make sure that we find synergies between the countries so that we can learn from one another. We can really align what we do and really coordinate, the work from the many partners that are working to support our healthcare development. So in the specific case of health emergencies that you mentioned, and right now here in Rwanda,
we are having the Marburg.
You have Marburg.
Yeah.
The way you're managing it is very good.
Thank you.
Yes. No, really. I mean, usually, it can be up to 88%, fatality, and I think it's below 25, so it's really good. But there is also Mpox in other countries. Ebola is never far away. I mean, we're always facing issues, and there are many reasons for that. I mean, zoonoses, demographic pressure, etc. But what I want to say is that at the core of our mandate is really the fact that we need to coordinate information from various countries, and this is really about surveillance. If things are happening in a given country and people are traveling, of course, the other countries are at risk. So what we do is that we help countries leverage the various framework that exist to collect data, and then we help make sense out of the data, and then we can say, oh, there is a trend here, maybe we should investigate this. Maybe the risk that we're facing, we have to see what is happening. So that's really about surveillance and detection. once we know that there is indeed an issue that could turn into an epidemic, then we need to really respond. And that's also where we work with the member states, but also with WHO Afro and WHO EMRO. It's really important to understand that we're not working in a vacuum. There is a whole community of large organizations, and when it comes to emergencies, WHO Afro, so the 47 countries from everything from except the northern part of Africa, and WHO EMRO and us, Africa CDC, we have a clear distribution of roles and responsibilities in terms of who will do what.
Yeah.
And then digital now, where does it sit there? So at Africa CDC we do event-based surveillance, which is really trying to make sense out of the many elements that are popping up, a little bit everywhere. And about, people speaking about something here, people that are maybe there has been a few cases of all those very low signals.
Yeah.
We're trying to make sense out of them, and then digital and AI are extremely useful when you want to do that, because that's a very difficult thing to try to consolidate and make sense out of the many signals to say, oh, let's investigate here. So that's a clear area where surveillance of epidemic issues can leverage digital.
Wow, thank you. When we are talking about this AI and the digital strategies and all the others, people think it and take it as if it is for the IT people, like for someone who are more skilled in that thing of the AI and other related technologies. How do you link it with the communities and even those who may not be specialized in those sectors? How do you take it to the lowest level so that everyone at any community, at even the village community, can understand this and use it in changing their communities?
AI is like, if you're a user, not someone who will code and develop tools, but if you're a user, AI is having a team of colleagues who can work with you, that you can discuss with. That's one of the very easy use cases with LLMs, large language models, or even SLMs, small language models. So basically it's about making sure that you leverage big data sets and you make sense, not you, but the model will make, the AI model will make sense of those big data sets to provide you with answers. So that's, once again, that's only one use case, but that's the most common use case. It's basically AI chat systems. And everyone can use that, Now, the one thing that is important when we think about LLMs, ChatGPT, Anthropic, Claude,
Gemini.
Exactly, there's some Llama, there's so many of them. The one thing that is very important is the data sets themselves that are being leveraged by the tools. And what is important for us is to make sure that in Africa we have data sets. 85 or 86% of everything that is on the internet is in English, which is actually a first bias, right? So what I want to say here is that our activities here in the health space, but also in other spaces, have to be in our own languages. Our own ways of working have to be digitized. When we digitize our activities, then we can fit them into. We can actually hand it over to entrepreneurs. It's not only LLMs. We can hand it over to entrepreneurs to play with it and develop those new tools, those new digital apps. Not sure I answered everything, but so data sets, African data sets is very important. How do we contribute to that? By making sure that countries understand that they need to work with one another, we cannot have 55 different sets of rules. Very often you don't have enough data of a specific type in a given country, so you need to work across countries. We have the regional economic communities, but we have the continent. The earliest will work as a continent, the strongest we will be. Otherwise, we'll have digital tools leveraging data sets from the north that are spitting out answers that make no sense for us.
We are here in this summit and you are partnering as the Africa CDC. What's the summit benefiting from the Africa CDC, and specifically for the African CDC, what are you benefiting from this summit?
Yeah, so first of all, I'd like to start by saying that this summit, I mean the idea, the origin of it comes from Jean-Philbert Nsengimana.
Oh,
yeah.
wow.
So that was his idea. And basically the objective is to make sure that there is once a year here in Kigali the possibility for everyone who is interested in digital health in Africa to work together, to learn from each other, to network, to present whatever they've created, and make sure that through the lowest level is really about re-energizing people, you know, because we get to hear great experts that are, you know, opening doors.
Yeah.
But it's also about really finding those projects that we could work together, you know. All sectors, all industries need places and times where everyone, all the professionals come together. And what we want to do is to make sure that here, HTS, Africa Health Tech Summit, becomes the annual, time where the whole community comes together. Yeah. And for us, we're like all the others. Like we're getting to network and to learn from everyone and to design projects together, etc.
Yeah, wow. Thank you so much for your time. It has been nice, and I hope some people understood something better and something more than what they have been having. And maybe let's meet next year.
Of course. Thank you.